Hi, Panacea. Welcome to the second episode of Panacea Pod. Today we have our board certified plastic surgeons and co owners, Dr. Singh and Dr. Abboushi, and we're going to be getting to know the doctors a little bit more personally. Starting off with, what made you want to become a plastic surgeon?
Um, I love working with my hands, and I knew that when I was becoming a doctor, that I was going to choose a specialty that allowed me to work with my hands. And one of the rotations that I was on, I think my second or third year, was with a plastic surgeon during medical school. And in one day, we were able to do so many different things. We started off by working on a newborn with a congenital deformity, and then it was followed with a tummy tuck and then a breast reconstruction, and then we ended the day fixing somebody's jaw after getting into a motorcycle accident. And I love the fact that it was definitely a wide variety of things, which were all interesting and fun to do.
Thank you. For me, I actually always wanted to be a transplant surgeon until like, since forever. So I kind of stumbled on plastic surgery during my last year of medical school, right before you kind of need to decide what you're going into officially and applying to residency. I did a month on a plastic surgery rotation, and really just had the intention of getting to sew a lot and learn, to suture better. But instead, in probably the first 5 to 10 minutes of the rotation, I fell in love with the people, the patients, the relationships that um, the plastic surgeon that I was shadowing had with his patients. And I just knew that this was what I wanted to do.
Wonderful. And the people want to know, what were you like growing up?
I was a, I was a pretty shy kid, actually.
That was so sweet.
When did you first realize, okay, I actually made it?
I don't think I've reached that point yet. Um, every day I feel that there's a new challenge. And from my perspective, I think that keeps me on my toes, and maybe you have a different answer.
No, I couldn't agree more. I am humbled every day. Um, and I don't know, I feel like there's always more things to learn. Every patient teaches us something, and I, I'm not there yet.
Now, something people would be surprised to learn about you?
um, so I did my undergraduate in biomedical engineering. It's kind of weird and strange, I guess. What about you?
That I did a master's in biochemistry.
Very
Love it.
cool. Now, what's the biggest misconception people have about y'all?
I think when people first meet me, they think I'm a little standoffish or a little arrogant, but I think it comes from the fact that I am shy and quiet. And then when they get to know me, that they realize how sweet I am.
Um, I think sometimes when you first meet someone and you say that you're a plastic surgeon, people make some assumptions about like the kind of person you are or what have you. And I think I'm pretty down to earth, and I don't think I act like a stereotypical plastic surgeon. So I would say that.
What's something your patients have taught you?
Um, Humility. Um, and honestly, how very difficult life can be sometimes. Um, I think again, just leading into stereotypes, like everyone has this conception of plastic surgery, and you're walking in and it's all glamorous and fancy, and um, I don't find that to be true. I think it's messy, and you get to learn about people's most vulnerable aspects of themselves, of what's making them come in to, want to be a different slash better version of themselves. And I think that teaches you extreme humility to be allowed to be part of that process for them.
Absolutely. I think that the main thing is that plastic surgery is not skin deep. It comes with so much more, and it helps people in so many different ways. And we're just, you know, proud to be part of that journey.
Amazing. And tell me, what's one patient transformation or moment that has stayed with you?
Ooh, so many. But I think the first one that really affected me was when a patient of mine who had patient of ours who had lost a lot of weight, and we did a significant body contouring procedure on them. And they came back and they thanked us after being able to fly for the first time. And so there was their first vacation, and they were finally able to get um, comfortable in a seat on an airplane, and they were so thankful that we were able to give them that.
Um, yeah, I think the many patients stand out when you ask that question. But I think for me, the patient who stands out the most is a young woman who had been married for a while, who, after having, body contouring surgery for the very first time, was comfortable with her husband seeing her naked. And to me, that just, I love that we were able to give her that confidence and for her to be able to, feel comfortable in her own skin.
Both of those were so beautiful. And what do you do outside of work that has absolutely nothing to do with medicine or healthcare?
Um, well, for those people who know me, I spend most of my time out of work on a soccer field with my kids, which I absolutely love so much.
Since the pandemic, I've been relearning how to play tennis, so I try to do that as much as I can when I can.
Amazing. And what's something you're currently obsessed with?
Um, Fixing a lot of things at home. So I'm a big get on YouTube, figure out how things work, to the dismay of my family and my wife. And then the next thing that I find myself doing is I'm at a store buying components and trying to fix a non-functioning dryer or washer, which I really find fascinating that I can figure that out on just watching a YouTube channel.
I enjoy hearing all those tales. Um, I actually recently started taking tennis lessons, and I am super obsessed with tennis, even though I'm not very good at it. But I love playing, and actually, Dr. Abboushi and I played tennis this morning, and he lets me feel like I'm doing much better than I probably am.
Now, what's your guilty pleasure show, song, or food?
Mm, lots of those. I would say Sex in the City, for sure. Show-wise.
Ice cream. I can eat a tub.
Now, who is more likely to check work messages on vacation?
Me.
What was
Both. In
Yeah.
fairness, both.
absolutely. What's one thing you genuinely respect about the other doctor?
Her work ethic, and her devotion to her patients. I been around so many doctors for so many years, I have not been able to find one doctor who has that much devotion and connection with her parents as.
That's so nice. I would say the same thing for you. I think that's what sort of bonded us to form this practice. Actually, is we both, as some of you know, we both trained at Emory. We both went through residency fellowship together, and we would often talk about sort of like how we felt like this could be so much better, like in terms of how patients were cared for and the level of sort of buy-in from the surgeons. Um, that I think we both saw a lot early on of what we didn't want to be like, and that was really helpful to sort of decide what we wanted to build.
Beautiful. Where do you want Panacea to be in 5 years?
So I already think Panacea is a pretty special place. And I think that I would love for Panacea and our message of, inclusivity and just acceptance to be able to reach more people. So I would like in 5 years for more people to know that we exist. Um, because I do think that, I think we're both good surgeons. I think you can find a lot of really good surgeons out there. I think what makes Panacea different is the fact that I think we really, not I think, I know we really care. And everyone who is a part of our team really cares. And I think that's such a unique situation, from our amazing medical assistant to our front desk staff to our you know nurse injector, to like literally fill in the blank, everyone, to our patient care coordinator. Everyone actually cares. Like if a patient calls and they need something, everyone is going to work to try to figure out their problem immediately. And I think we are so lucky to have the staff that we have.
Beautiful. And who is more likely to make everyone laugh in the OR? I think we know this one.
Absolutely, it will be me.
It would totally be you. Yeah.
Yes.
Okay.
I'm the clown of the practice.
If you could go back and talk to yourself on your first day of medical school, what would you tell yourself?
Ooh, enjoy life more, and it's okay to fail. I think when I was a medical student, you did everything to try to not fail. But I think the moments where you fail are the moments that you learn the most. And it makes you, especially in this field, a better doctor, a better surgeon, and eventually made me who I am, as far as how I care and take care of my patients.
Um, I would say I would love to tell that person, um, to not feel like you have to do it like everybody else. Um, I think that, you know, as a woman, especially coming through, not necessarily med school, it's pretty equal, but getting into surgery and plastic surgery fellowship, I was by far, one of the very few women in the room. And I think that you feel that you have to sort of just assume the role that everyone else is putting forth. I didn't have really a lot of female mentors. I didn't really know how to forge this path, as a woman who also really wanted to have kids and a family. And I wish that I had just not felt like I had to do it the way all the men around me were doing it. That there were other ways that you can do both.
You're a special man. You just needed to find.
There were. 100% true. You're a special man.
Wow, both of those were very inspiring. It's amazing to hear from you guys. And I know